Neely, we've got to share it from my feed, from my personal timeline. If you want me to share it, just say so. Okay, I just started. Feed from my personal timeline. If you want me to share it, just say so. Okay, I just started. Go ahead, Neely.
Good evening, L-Town. I imagine most of you are watching this evening from what I hope is the comfort of your own homes, where we've been socially distancing and remote working and remote learning now for just about 2 weeks. And I hope it's starting to feel a little bit routine. You're having some sense of normalcy in this really extraordinary but temporary time. At the same time, a lot of us are starting to hear about friends, both local friends and friends from out of town who are sick. And unfortunately, some of them are requiring hospital attention. So our prayers are with everyone at home who is ill, or caring for someone or worrying about somebody who's ill. We thought tonight would be a good time to bring Mayor Rudy Fernandez and our township manager, Barry Lewis, and our town health officer, Lou Anello, here to speak with the community and answer some of the questions that I'm sure many of you have with respect to the COVID-19 pandemic and specifically its impact on Livingston and its residents. So I wanted to introduce Mayor Fernandez, but before I do, and I know he wants to share some words with us, but before I do, I also wanted to thank Robert Allen and Holly Ehrlich of New Media Connection, who have stepped in yet again to serve our community and are hosting and producing this forum for us tonight. So thank you to both of you for your help and being such devoted and dedicated citizens, residents of Livingston. I also wanted to thank our town council and our Board of Education, who have really stepped up to the plate and had to make some last minute changes to care for all of us, and certainly all of our township employees. And we wouldn't be functioning without you. And also a lot of our residents have been taking it upon themselves to start charitable initiatives that are really giving back to the community, helping our doctors, our medical staff, our nurses on the front line, and also supporting local businesses. So really a lot of generous and creative initiatives coming out of our community, and I wanted to take a moment to acknowledge that. But now, Mayor.
Thanks, Neely, for hosting this. And as you said, these have been challenging times for all of us. But with everyone working together, we'll get through it, and probably, and I'm sure, and I know stronger than before. But I do want to recognize many of those who have gone, above and beyond. And this is not certainly all inclusive, but I did want to, just touch upon them. First, the township staff who are there making sure that our municipal services are keep going uninterrupted. And certainly, Barry, Russ, our deputy town manager, Glenn, our town clerk, Carolyn, our deputy town clerk, that are keeping us informed of everything that's going down at town hall. To the police, fire, auxiliary police, first aid, we owe them a big thank you. They're out there, all day, all night, making sure that we continue to be safe. To our Board of Education, as you've alluded to before, our Superintendent Matt Block, and all of the teachers for all the incredible work that they are doing. To our local businesses and their employees who are out there every single day, making sure that we can get out and get to the stores and get to the things that we need. And a big thank you to them. And let's be supportive of all our local businesses. Make sure that you can order out from them. If they have websites, to order online from them. We can still continue to support them, and we should during this time. Big thank you to the doctors, the nurses, all the health professionals who are out there on the front line. And thank you to St. Barnabas Medical Center, as always, and Margie Heller for all the work that they are doing. And if I can just give a quick plug that there is a Livingston Community Blood and Platelet Drive that will be held at the Livingston Community Center. And that is on Friday, April 3rd, 2020, from 10:30 to 10:30 in the morning to 4:30. And then on Tuesday, April 7th, 2020, from noon to 6. Appointments are required, and this information will be made available. And you can do so by calling 732-235-8100, extension 221 or extension 248. But that information will be made available, please consider donating. As Neely alluded to as well, thank you to all the residents who have really, really stepped up. We always say that Livingston is a town full of volunteers, and you've certainly seen it, during these past couple of weeks. So to all the volunteers that have come out in such great force, thank you all so much. To the West Essex Tribune and the Livingston Tap, Mike Izzo and Danielle Santola, you've been really helpful in helping us get information out to the community. And if anything, it shows the importance of the press, both online and print. We need them very much to get the information out to the community, and we thank them very much for doing so. To our other elected officials, Senators Menendez and Booker, Congressman Mikey Sherrill, the county executive, Joe D., and all the Essex County freeholders for their constant communication with us, the constant conference calls that we've had. The information has been invaluable, and we thank them very much. And last and certainly not least, to my fellow colleagues and council members, Deputy Mayor Sean Klein, and also Ed Meinhardt, Al Anthony, Michael Vieira. We work together as a team, and they've been working just as hard as anybody else in responding to resident requests, interfacing with other elected officials, and working with everyone to make sure that people are responded to, and we can get the help that we need to get to whoever we need to. So a big thank you to them. It's certainly they take a lot of load off of me, who happens just for the for this year to be serving as mayor. They've also Ed, Al, and Sean have all served as mayors in the past. Michael, future mayor, and they big thank you to them as well.
Thank you, Rudy. I think I'm going to start by asking some questions of our town health officer, Lou Anello. So Lou, I think your mic might be okay. Good.
I'm sorry about that. Sorry.
We're all. I didn't know what Zoom was a week ago, so this is all new to me.
This is my second Zooming.
I know this is an ever-changing number, unfortunately, but based on your last notification, what is the current number of reported and confirmed cases under investigation in Livingston and in Essex County as of this
Sure.
evening, I guess?
Sure, I have those statistics available. And before I provide you with that, I just want to give a shout out to my staff who has been working very diligently through this whole process. It's something that, it's a 24/7 operation for us, and we're continuing to work and getting the statistics in and providing as much information that we're allowed to provide to the public and to the state. So I want to thank my nursing supervisor, my health educator, my public health nurses, my assistant health officer, and the staff that I have has just been supportive in trying to make the office comfortable through this process as well. Currently, in Essex County, there are 615 cases as of today. And out of those cases, there are 13 deaths total. In Livingston, we have 46 cases and 1 death, which is the 3rd highest for the county. There's only two other Essex County municipalities that are higher than us, and that would be Newark and West Orange at this time. So just to answer your question, I just wanted to get the statistics out that I think our numbers are on the higher side, but it's the information that's being provided for us and the work that we're trying to do to contact investigations of these people.
And do you know how those numbers compare to yesterday or the day before in terms of getting a sense of a projection of growth?
Yeah, it goes up depending on the cluster of cases that we get. So as of yesterday, it went up actually 6 cases, which is a lot for a day, but not unusual if you have a cluster of people that have been together. So they're all coming in at the same time.
How is the health department receiving notice of positive cases, and who is doing the contact tracing?
Sure, we're a part of the state's CDRS reporting system. It's a communicable disease reporting and surveillance system. On this system, we respond and receive all communicable diseases that are reported on a local level to our jurisdiction. So when a person or an individual is tested, the lab that confirms the test goes into the CDRS system. That is what we get notification of, and that's how we start our investigation.
So what does that investigation entail? Do you then ask the person to retrace their steps, and you then go back and ask, you notify people who have been identified, or?
Exactly. We try to do our best to go back to make sure that that individual can give us as much information that they're aware of, so we can contact those people who've potentially been exposed when they were communicable. So once we do our investigation, we do tracking our family first, and then we go outside that to find out who else outside, maybe the work environment, maybe social environment, just to prevent and notify those people that there's a potential risk that they would have to self-monitor themselves.
So I know that there have been some instances of fraud and scamming. How do residents know if they're being contacted by the right agency or individual?
I guess that's a good question. We definitely identify them ourselves as, our number comes up as a governmental agency. And if they're skeptical about that, they can call us back, and we'll address that situation for them calling us. So we're giving out our number, but that doesn't happen because most of the time, as we present ourselves, they probably know that we're going to call because they've already been to a physician who's already taken the results to a lab, and they've already been told, hopefully first by their physician.
No, I meant the people who've come in contact with, who are they going to get phone calls from?
Well, we'll do the initial phone calls to reach out to as many contacts that the person who was confirmed to us is being positive. And then individually, they are supposed to hopefully contact anybody that they know that they inform us with that might be at risk as well. So it's a multiple layer of communication. We do as much as we can from the information that we receive, but then also they should be notifying other members of themselves that they.
So individual residents should also be taking it upon themselves to spread the word if they are
yes.
in fact infected.
Yes, it's nothing. Yeah, it's the way we're trying to prevent more people self-quarantining themselves because they know they might have been exposed to someone who just was confirmed positive.
And of course, people should be reminded there's no shame in sharing that you have tested positive. This is just the luck of the bad draw sort of situation. Right?
Exactly.
Okay. Is Livingston partnering with any other governmental agencies in this effort?
Yeah, we actually partner obviously with the state, who provides us with the information as we need to know on a regular basis. All of our information that we report goes back to the state for those state statistics. We also partner with the Essex Regional Health Commission, which is a commission that does pandemic planning for the county. So we're in constant communications with them as well. And also with our local police and fire department. We keep them, and first aid squad as well. We try to keep them as informed as cases come in. We just notify them, of the case situation.
And I'm not sure if this is a question that you would answer, maybe Barry or Rudy would answer. How are our first responders, our police, and our fire department interacting differently with residents in view of current circumstances? Or are they not?
All right, I know that you've been having regular meetings with the chief. Our emergency responders, our first aid, have been working with Barnabas. They've become, they're also secondary on calls. And Barry, you could probably describe better the employee shifts that are taking place in order for them to keep, socially distance and to keep groups apart, and how they've been working both fire and police, and even as a matter of fact, town hall, because all municipal services are continuing.
That's right, Mayor, and basically, so as it relates to the operations, the police have divided essentially into two separate. Each shift that normally would have been 10 or 12 people together is divided into two, so that if there were an illness on one of them, you wouldn't infect the entire squad. As it relates to interacting with the public, they are taking precautions. They all have gloves, they have masks if necessary. The emergency and first responders are provided with information as to, if they're going to respond to an address where there may be a known positive case, so they can take additional precautions. They obviously want to try and continue to be friendly, but the level and social distancing does, it does change things, the dynamic a little bit. But certainly interacting with the public, trying to be as supportive as possible, enforcing social distancing, trying to remind people and groups of youths who may gather to not gather and break up. But everybody's really rising to the occasion. They're doing a great job.
If I can add to that, it's absolutely true also that our vital statistics department is still issuing birth certificates and death certificates by marriage, by appointment, but marriages typically we haven't had any recently. Anybody that was getting married, marriage probably just has been postponed. But we're doing that by mail. So anybody who still needs to get a birth certificate, the funeral parlors are coming to us for death certificates. So punctuality, we're still providing the service to the community and to other residents. Come to St. Barnabas and have a child, they would need to come to us. So we're still providing that service through the mail, and they can call the office for directions.
So they call the office on the website to?
Yeah, they can call the office, but when, for instance, for a birth certificate, they're given a form at the hospital. That's how they can request that document through the mail and have it done.
And how do you know as whether or not you need to be tested or whether or not you should just be self-monitoring? What are the recommendations now for residents who may not be feeling well?
Well, testing is very difficult at this time. There's a shortage, obviously. People know that there's a shortage of test kits. If your symptoms are relatively mild and you don't feel that you need testing until maybe the severity of your illness gets worse, then you should contact your private provider, your physician, your healthcare clinician, and see if you meet the criteria for them to test you.
So at this point now, you have to contact your provider. There's no drive-ups or any test centers set up in the area.
I wouldn't rely on anything on a state level for that particular reason right now. There has been a drive-through that was started today in York, but it had a limited amount, and you had to be pre-screened for that. I heard it was very full. The 3 other test sites that they're going to provide are going to be for medical responders only, first responders. So residents will not have that opportunity to go to York to have to be tested. So the best bet is just going to your local physician, and you should have a way of forwarding the information where you can get tested.
Okay. And we've been hearing a lot, I guess it's a new term for a lot of us, social distancing. How is that different than quarantine? When do you quarantine and when do you social distance or socially isolate?
So social distances should be across the board. Everybody should be social distancing themselves. The standard is 6 feet away from somebody you don't know, or even a family member if you're actually symptomatic. So people should be quarantining themselves if they become ill at their home, at their own residence. And that's a 14-day quarantine period, just so they can self-monitor themselves in case this scenario or situation gets worse. But quarantining themselves is recommended for anybody who has symptoms, flu-like symptoms, for a minimum of 14 days.
Okay. We've received a lot of questions from residents who want to know whether or not it's safe for them to go food shopping. And if they do go food shopping, who should be going food shopping, who should not be going food shopping, and what steps can residents take to protect themselves when they're out?
I would say they should limit their food shopping to when there's a necessity need to go food shopping, not just to go out to get out. We are telling people just quarantine themselves to be maintaining their status at their residence as much as possible. If they need to go out to do shopping, which becomes essential, it should be an adult, and it should be only one member of the household, not even husband and wife, or not the whole family, obviously.
Okay. So just generally at this point, people should just be in their own homes. What is your recommendation to residents right now in terms of how to be conducting themselves?
People should be vigilant of their personal health. They should know that at any time where they become symptomatic with a flu-like symptom, they should definitely stay in their home, quarantined for the 14-day period. If they become severely ill and need to go to a doctor or an emergency room to be tested, that would be the protocol. That is on their own at home. If they do that and they're tested, then we would be notified to provide that contact information of their close contacts and who might have been exposed to. It makes it easier for us if people reside and stay at their home, because if they are positive and we do have to do contact tracing, their amount of people that we would have to contact or they would have to notify would be minimal.
Okay. Thank you so much for joining us this evening. I know that your department is working overtime to meet the needs of the community, and we thank you very much for all of your professionalism and dedication to our town. I have a couple of questions for the mayor, for the town manager. I guess, Rudy, how's the town council continue to function during this crisis? Have there been any changes?
It makes it a little bit more difficult because we can't be around each other. But certainly, electronically, we've been communicating, we've been getting information onto the website. We need a big thank you to both Judith and Juliana for taking care of that. We've also been posting on social media, but we've been communicating with each other, whether it's a cell phone, whether they're texts, whether they're emails, whether they're calls. We've been communicating well. We were able to do our very first live stream town council meeting. They had passed that legislation just maybe a week or so prior to that. So doing that was basically new to every municipal body. And both Barry, Russ, Glenn, Carolyn, Juliana, and Judith in getting that set up. So we've been able to communicate. We plan on having the online council meetings for a while. There may not be a lot on the agenda, but we want to be able to provide information to the community. So we plan on continuing to do it that way as well. We're scheduling one for Monday. So we'll be back doing it. And again, doing whatever administrative work needs to be done and updating the community on what's going on.
Can you just share with everyone how people can watch the town council meeting on Monday? That's going to be live streamed. I guess it'll be live streamed on the town website or
Town Facebook
Facebook.
page. The town Facebook page.
Town Facebook page.
It will be on the town Facebook page. I think LTV, Livingston TV, will be to their feed as well. So they're an important part of the community, and we're putting it out through them as well.
Great. And so will that be viewable on television as well? Just not live after the fact, or just purely on social media?
No, it will go on TV afterwards. We cannot do it live because we don't have access to the studios.
Right.
But the Board of Ed, the superintendent, they've been terrific on the committee person to get into the studios for the purposes of putting it on television as well once it's burned to a DVD.
So that's terrific. So the entire community, people who aren't on Facebook and people who are going to have access to all the information that you need to share with residents about things that are going on specific to this current circumstance.
Yes, and that's always that's always the difficult part of getting out to the community. There are many people that are really connected to social media, but the reality is that there are a lot that aren't, and it's getting it out to them. And again, that's why, in addition to the digital media, the print media is so important, because a lot of them get their information that way. Our senior youth and leisure department, Jen and Liliana, have been working really hard in reaching out to the senior communities. And working with them. So we're trying, we're doing our best, and I think doing the employees doing a great job in getting out to a lot of those people in the community that aren't necessarily connected to social media as well.
I know that there are some municipal departments that are still operating in full force, some that aren't. Can you sort of break down for us what services are still being provided, what have been suspended or postponed? I know that my garbage is being picked up. What can residents expect?
I can take this if you want, at least
Great.
take a stab at it. So obviously, when this situation developed, we had to look at how do we provide the services while still protecting social distancing. Essentially, we looked at it. What are the essential services that we provide, and what are the sort of extra services we provide? So almost from the outset, we suspended all senior programming, recognizing that they're in an at-risk group. Recreational programs, anything that is it's nice to have, but it's not essential to continue your day-to-day life. At the same time, we looked at our other departments. Some of them are very obvious: police, fire, first aid. Certainly in this case, the health department. Obviously, we have to continue all of those services. Others that people may not think of: garbage, recycling, water, the sewer utility. Obviously, the sewer plant has to still run, so that requires personnel to run that. The water department, they have to respond to leaks, they have to maintain the pumps, they have to treat the water. So and then behind that, the sort of administrative backbone that needs to keep all those operations going in terms of paying bills, paying payroll. We also, I think, really wanted to, and I think we did a good job. What we did is basically shut down all the buildings to the public, but continue to do all the services as to the greatest extent possible that we could, so that people can continue to live their lives. So basically all of our core services, other than, again, sort of recreational and things that are clearly more optional, have continued via phone, via email, a lot of forms online. The tax, water, sewer, finance is open. We're still paying our bills. The building department is still accepting and processing building permits, recognizing people are in the middle of a project with a lot of money at stake and trying to build a house to move into.
Yeah, I want to ask you a little bit more about that in a second, because I did get a couple of questions about that.
Yeah. So we have done everything we can to continue to the greatest extent possible. Obviously, excluding the public was part of the necessity within our forces, in part because of a little slowdown in the workload, but also because of social distancing. We've sort of divided our forces, have people coming in on alternating shifts to minimize the number of people, minimize the risk that one person comes in sick and gets all of town hall sick, and then we're done.
So town hall is still open just to employees or to the public as well?
Just to employees. There's an outside drop box for payments. The building.
So you can still pay your taxes, right?
You can pay your taxes online. You can drop your water bills. Yeah.
And then the police department, if someone needs to file a report, because life is just normal everywhere else too, are you able to file a report? Is it better to make a phone call and let them know you're coming in?
Yeah, definitely. You start with a phone call. Depending on what the nature of the report is, it may be able to be taken over the phone. It may be a situation where an officer can be dispatched to whatever location you're at to take the report. In certain scenarios, obviously, if there's a you hate to think of it, a domestic situation where somebody needs to come and get a restraining order, the front desk is open. They can come in the main lobby, which is generally where the public was restricted to anyway. They couldn't just have the run of the police department. But so we are, all options, but certainly I would suggest, other than an absolute emergency, call 911. But in terms of, if you believe you need to come in to file a report, get a report, to call first, and then they'll handle it appropriately.
Can you walk us through a little bit about what's happening at the construction department in submitting permits or getting inspections on existing projects, and just different projects and how they're going to be handled, residential and commercial? Yeah,
so obviously, again, recognizing that, construction is one of the industries that is not stopped, right? So the governor's orders allow construction projects to continue. Many people, some homeowners, some commercial developers have projects in the works. They have a lot of money at stake. So we're trying to do everything we can to maintain as normal a situation as possible there. Permits are still accepted. There's a drop box outside town hall. They can drop off plans. The department then picks them up. They review them, go through the normal process. Inspections are continuing. The only one caveat is certainly if it's a brand new construction, so that there is nobody living there, those inspections are no issue. If they're exterior inspections, those continue as normal. If there's an interior inspection of an occupied house, then obviously there's some threshold screening going on. Is there anyone there? Are they on a location of a known case, or is there anybody there that they either travel to? And so in that instance, there still can be situations where maybe it's just a potential self-quarantine but not a confirmed case. Maybe the resident can just they won't be in the same room. The inspector can wear a mask and wear gloves, but we're doing everything we can to keep that all the business that we do going, so everybody's life can try and stay as normal as possible. So residents or general contractors can schedule inspections as they normally would, but they should expect a little bit more lag time to get somebody out there? Or we still have all our inspectors on their full schedules, so you wouldn't really expect a delay unless it's a unique situation where, certainly if there was a case or a suspect case or quarantine at a particular house, that may necessitate some logistics and arrangements. What about variance applications? Are those still being accepted? Well, applications are being accepted. Right now, we're still, the guidance and the legislation that the mayor referred to allowed us to have our electronic town council meeting, we're reviewing that in terms of how can you and could you apply that to a board of adjustment or a planning board hearing. That's a little different because there are witnesses and there's evidence and there are exhibits and there's things that put up on boards that the people in the public that are there are supposed to have the opportunity to see and ask questions about. And logistically, I think that would be very difficult to do electronically. So I think for now, we're kind of, it's a wait and see approach. We're kind of temporarily halting them for now. If hopefully this looks like it's going to resolve sometime in the not too distant future, then I think that would be the approach. If we find ourselves in a situation where we're potentially looking at months and months, then I think we will have to figure out a way to do that, just again, because people have things that they're counting on and we need to get them done. We've received a lot of questions about our seniors, in particular, the ones who participate in your program or those that may not have supports. What is being done to reach out to them? What accommodations and services are still available to them? And obviously we understand that the general recreation ones have been suspended.
So the
The senior groups themselves are having their own phone chains where they're reaching out to each other and making sure they're okay. They are then also working with people from our senior youth and leisure department, and we're reaching out to them. They're reaching out to us so we can try and make sure that we're covering as many of them as possible, making sure that they are okay. We are connecting volunteers, seniors that may need shopping done for them or other things done for them. So, the way we're doing that, people can, volunteers can reach out to myself or, any of the other members of the council, Sean, Ed, Michael, or Al, and we will then forward that information over to Senior Youth and Leisure. One of the things that we started talking about just today is, there's a phone number that people can call people can call in to see if events are still going on, and whether programming is still going on. So we talked about today just and leaving a message, where they can call in and just receive information on how they can get connected with us. So they can call to the phone number. It would have a general message there that that we can place there and say, okay, if you need to get a hold of somebody, this is how. So we're working really hard to make sure that we can reach that portion of the population, whether it's to go to their homes and do and bring things to their homes. The other thing is too, some of them will go to one of the local stores and just may not want to go in. So we can perhaps even get volunteers to meet them there and meet them at their car, do whatever shopping needs to be done, then bring it back to their car so they don't have to go into the store themselves. So they're doing a really great job in reaching out to to them. And we've been trying all avenues outside of social media to connect with them.
If I could just add to what the mayor indicated. So, one of the critical things we provided is senior transportation. Obviously, we've suspended all sort of recreational senior transportation trips, but also even recognizing that the bus was not really an appropriate environment to bring a bunch of seniors because you're gathering. We, Liliana and Jen Walker over in Senior Youth and Leisure Services worked very hard, worked very closely with Essex County, including Councilman Vieira, who works in the Essex County. And so we've now arranged essentially what's a dial-a-ride. So it's one person will pick up one senior and can bring them to medical appointments, grocery, the pharmacy, only actual, not just luxury trips. So on that, it's on our website. I'll certainly provide it, and to the extent you can post it on your forums, that's great as well. There's a phone number you call in. The number is 973-535-7925, and you select option 8. The one thing you need to know is any senior, you have to call by 2 p.m. the day before that you want the ride to allow time to coordinate drivers and have people pick you up. Another one that Rudy alluded to is we have a lot of volunteers expressing, how can I help out? Can I help a senior? Can I do grocery shopping for them? That's currently being funneled through our licensed social worker, who's actually with Lou's office, Anna Milan. And there's a number you call there that again is 973-535-7961, extension 231. And that's where if you, a senior that can't get a ride and go do their own shopping, but could use assistance shopping, she's coordinating and screening and matching up volunteers. So again, I think a really good service where we're able to meet the needs of our seniors.
Is that information available online anywhere?
It is on our website. I believe Neely, I sent you the link to the one page earlier today, but I can send it again.
Yeah. Maybe if we could send it again and we can post it on social media.
Whatever we can do to get the word out, absolutely.
Yeah. And so that's information, that's a contact information that residents can use to get help and also to use to offer to volunteer to help others.
That's great.
That's terrific, because I know that we've received a lot of offers on L-Town residents who are anxious and happy to go and assist residents who aren't able to leave their homes.
Great.
So in terms of physical buildings and facilities, which ones are open and which ones are closed?
So basic buildings, essentially all of our buildings are closed to the public. So, again, under except unique circumstances, if there was a need for somebody to go into the police department and the police determined that, they may get in, but essentially all closed to the public. virtually all of them open and still operating with the employees. As far as facilities, obviously the buildings and those are all closed, but even we've closed tennis courts, basketball courts, playgrounds, things where, so groups of people might gather, things where people might leave, the virus, if one person's on a playground equipment, another kid goes right after it. So those are all closed. Parks in the sense of the oval, just to go out and take a walk or exercise, those remain open. Obviously, we want to encourage people to follow social distancing, not be in gatherings. The police have been instructed to, if they see groups, and typically it's younger people that tend to all of a sudden turn into a group that's bigger than we like, the police will sort of politely tell them to break it up and to distance. And, we're not arresting people or anything, but basically most of the facilities, other than just sort of walking on the sidewalks, are closed, unfortunately.
If Barry, if I could just follow up for one additional item. The library is also closed, but they have increased their online offerings. You'll go to the Livingston Library website. You can use your library card. You can get information. You can download ebooks. Amy has done a terrific job on expanding what's available online to the library card holders. So even though the library is closed, there are plenty of services still available online.
Rudy, this is, I think, a question for you, but I think Barry also could answer it. We're going to look forward a little bit to hopefully a couple of months from now when we're out of our homes and returning to some sort of normal life, but there will be real economic consequences in our town and in our state and I guess globally. How will this crisis impact the township's budget and the recent assessment of real estate for tax purposes? What is your general idea of how the budget and also collection of revenue will be impacted?
Well, right now, Barry's working through the budget. It'll be finalized shortly. So Barry knows what the priorities of the council are. Regarding our where we want to keep taxes as low and as level and no increase as possible. So Barry will be working through some of those. In addition to that, when we declared an emergency, that allowed us or may allow us to access federal, state, and county funds as well. So we're looking to see how we might be able to incorporate that into our budget as well. But Barry's been working through it, so he's probably in the best position to talk about some of the details.
Yes. So following up with what Rudy said, obviously every year my charge from the mayor and council is to develop a budget that minimizes any tax increase while maintaining, if not improving, all the services to the residents, because all those services are what make Livingston the place that it is, that people want to come live here, and we don't want to scale back and cut all the services. So that's sort of that's the starting point every year. Obviously, with this year and the uncertainty and certainly the economic issues that are going to follow, I'm confident that and I'm sure the mayor and council are going to also. What else? What more can we do? Can we get it down to no increase? Can we? We are very fortunate that we're on very good financial standing. We have significant reserves in place that we can sort of subsidize a 1 year, and where maybe we would have a little increase, and instead we can subsidize it to delay. And then obviously any other issues that where we're looking even right now in terms of some of it, we're waiting for state legislation to authorize it, but in terms of tax due dates, tax penalties, interest on water and sewer bills, recognizing that for people to get back on their feet, they may need a little more time to pay some of those bills. So we're certainly going to be flexible and look at every opportunity that we have to grant leniency to minimize any economic pain that we inflict, on the public. And also, as Rudy alluded to, we will aggressively be pursuing, the recouping any expenses that are incurred through, if FEMA funds are made available, any state funds are made available. If there's ways that we can get that, which will reimburse some of the expenses we've had to the benefit of the taxpayers, because they won't have to pay, and we're going to do that as well.
I think you kind of spoke to my next question, which is what are some of the steps that the township is going to take to address some of the economic burdens that residents and small businesses are going to be experiencing in the next couple of months. But is there anything else that you want to share in that?
Well, certainly the businesses, to one degree, those that own their property, that their business, they would be impacted by the taxes, the water, the sewer, and all the things I just talked about. But at the same time, there are also a lot of businesses that are tenants or they rent, and in some instances, maybe the taxes are passed through, but depending on how it's done, they may not see the relief. We want to be very supportive of the businesses. We'll be working and hopefully in an expanded way. We'll see very shortly with the bid to promote those small businesses. It was kind of alluded to earlier. I think the mayor mentioned it at the beginning. To certainly encourage residents who, these businesses, whether they live in town or not, are still part of our community. We want to support them. We're going to look to maybe create portals where you can go to one spot, you can find out every restaurant that's open for delivery, for takeout, every business that wants to have a listing there that they are selling gift cards or gift certificates. It's a way to get them cash flow that maybe you then use the gift card somewhere down the road when they're back open, but you're helping to support them now. So.
And I think you'll find many of our residents are really eager to support their neighbors, and they will happily participate in all of those initiatives.
Yeah. And one of the other things that, Neely, since this started, I received an email that there's going to be a conference call tomorrow with both Senators Menendez and Booker to learn about what's going to be available to all the local businesses through the stimulus package that's working its way through. So that'll be another avenue, and I know that we'll be working with the Chamber of Commerce, with the Business Improvement District. My colleagues on the council will all be working to see what we can access there in order to help all of our local businesses as well.
So that you think that comes as a lump fund that gets distributed, or it goes individually to each business?
That's one of the things that we'll be learning about tomorrow, is to see where that legislation is and what will be made available. I think a lot of them maybe through grants and forgivable loans, and we're going to be learning the details as they're learning the details. So we want to make sure that we have the best information and we're able to get that to our local businesses, to our Business Improvement District, to our Chamber of Commerce. So what is out there, we can make sure is made available to everybody here in town.
Yeah, and to that point, just following up, I expect we haven't seen the legislation. We don't know exactly every form that it's going to come in. I have not heard any suggestion that there's going to be any direct grants to municipalities to then dole out. So I suspect that it's going to either be directly to businesses or via the state, but certainly is to the extent it's direct to businesses, we're going to do and work very closely with the bid and the chamber to have one source where, collectively we learn all the ins and outs, all the rules. How do you apply? Where do you apply? Where are the forms? What do you do? So that we can then support each and every individual local business so that they're not on their own having to go Google, how do I apply for my stimulus?
So you're going to be able to help walk them through the process.
Exactly. Yeah.
That's great. And how do they know where to reach out if a small business owner is watching now and they want to know where to go and who to speak to about what their expectations should be? Where should they reach out?
Well, certainly I think once we put that effort together, we'll come up with a single point of contact. For right now, I would say certainly the BID, the Business Improvement District, Beth Littman, they have contact. But again, always the town, the mayor, the council, whoever they want to reach out to, we will make sure that once everything's up and running, that we connect them and we maintain a list of and contact information for every business to get back to. Right now we don't have a lot of information to give them, but we will certainly take their name and their contact information and maintain a list so that as soon as we do, we will go back and contact everyone.
So it sounds like the town is really planning to coordinate a lot with individual businesses to help them through a process that they're going forward.
Absolutely.
And one of the benefits is that many years ago, starting the Business Improvement District, is a way for all the businesses to stay connected and gather together and have one central point of contact. And it's worked well for all of these years, and we expect it to continue to work well. But as Barry had said, any business can reach out to any of us or go directly to Business Improvement Districts who they've been dealing with anyway throughout the years. So, we will do our best to make sure that everything gets coordinated and we can get the information out to everybody.
Terrific. Rudy, I actually watched the town council meeting the other night, and it was it was wonderful to see everyone there. It was very reassuring for the community. I wanted to get your sense of what you thought about the platform and if you think the town council members felt comfortable appearing that way and what the pros and cons were of a Zoom town council meeting.
No, the council members absolutely felt comfortable doing it. One of the difficulties was that the legislation to allow us to do it had just passed the week prior. So Barry and his staff were and Glenn and Carolyn and Judith and Juliana were scrambling as to how do we do this, because nobody, it hadn't been done prior, because town council meetings need to allow public participation. So trying to figure out how to allow public participation in that type of format was a little bit more challenging. I think that it works well. For certain instances, though, I think there are hindrances. And what I mean by that, say there's something more controversial that's been discussed by the council that requires a lot of back and forth and a lot of discussion and a lot, in us to learn from the residents in order to make a decision that
Valuable input.
And it's in that type of format, it becomes a lot more difficult because it doesn't allow for the back and forth that we would normally have at a town council meeting with somebody up at the microphone, where we can just go, speak back and forth and respond. And the typing of questions and responding that way makes that part of the process harder. So I think when it comes down to dealing with more difficult issues that would have a lot of back and forth between many residents, that part of the process, is hard. On the other hand, if we can reach out to more residents, that's always a good thing. It's always a good thing. So there are pros and cons to that process, and we'll be learning to see what works, what doesn't work. But I think the hardest part of it is really having that back and forth interaction during a meeting. But the benefit of it is that we can certainly get out to people that may not otherwise be able to come to one of our Monday meetings.
And to clarify for people at home, it might be confused because they've seen the town council live stream before that, taped. But the distinction is this was a meeting where you guys were not convened together, and that's where you needed to have an amendment of the legislation to allow, right? Because you're not in the same room, and the residents are not available to be in the same room with you to have that back and forth. So that's different than just live streaming a live meeting where everyone is in the same room.
That's correct. They're two different things, and these meetings require, as they should, they require public participation, and it's trying to, get those things together. It's not just live streaming a meeting; it's live streaming, getting public participation, and being able to get public input, and that's the important part.
Great. Final words from you, Rudy, because I think that everybody is doing the best to keep their spirits up and keep their friends and their family spirits up and their children engaged. And as the mayor, on behalf of all of your town council colleagues, what would you like to say to our residents to calm their fears and assure them that the township is going to address all of these concerns, and that with time, because this is just a temporary situation, we will be able to return to normalcy?
It is temporary, and quite frankly, we're very social people, all of us. And when we can't be together, it's difficult. It's difficult. With these platforms, it's a little easier for us to interact. And I'm wondering what this may have been like, 10, 15, 20 years ago. But now we can interact with each other, but it's hard because we're not with each other. But we will get through this, and before we know it, we'll be back at the Oval. We'll be back hugging each other. We'll be back shaking hands. We'll be back at the ShopRite complaining there are too many people there. But we will get through this. Livingston has gotten through many things. It's an incredible community. What also makes it so wonderful is the volunteers that are out there to help those that maybe may not be able to get out there right now. But there are terrific people, terrific volunteers. Terrific staff. All municipal services will continue. Your water will still turn on. Your toilets will still flush. So those things will still happen. Your garbage will get picked up, your recycling will get picked up. But before you know it, we will all be back together, doing what we do. So I'm looking forward to that time. I'm looking forward to it being sooner rather than later. But we will absolutely, without question, get through this.
Well, I wanted to thank all of you for your leadership, for your professionalism, for your dedication to our town, all of your departments who you work with, all the employees, our essential employees who are putting themselves on the front lines every day to serve us, our medical personnel, our teachers, our administrators, Dr. Block, all of our people who are working on our supermarkets and our restaurants who are serving us food and keeping us fed. Thank you to all of you. A lot of us are complaining from the comforts of our home, and there are others who are outside working really hard, and we appreciate and we recognize all your efforts. So thank you for everything. And I agree with you, Rudy. We're going to get through this. We're going to be stronger and more resilient for it, no doubt.
And Neely, certainly we appreciate you and also Robert putting this together.
Certainly, Robert and Holly, yes.
Right, to get this out there. Oh, there he is, Robert. And again, we're here, myself and my colleagues, the other council members, our information is on the website. We have our personal cell phone numbers up there. We have, there are many ways to get a hold of us, and please use them. We put them up there so people can get a hold of us. And again, not just during this time, during once the normalcy returns, the information up there doesn't change. We're still just as available. We were just as available before this. During it, we'll be just as available after it.
Thank you, no doubt. And stay safe, everyone.
Yeah, thank you, Neely.
Thank you very much.
Have a good night.
Have a great night, everybody.
Thank you.